Hi everyone, Dr. Nemechek here. It's important that you try to tie together, as you're approaching your medical problems and trying to tie them together and understand where they're coming from, all right? Because if you have, joint pain of some sort, you've got diabetes, maybe you've got high blood pressure, and you've got reflux, and they've put you on medicines, what they call forever medicines, like there's no end in sight that you could get off of this stuff. You need to be able to tackle the problem. You have to understand where it's coming from. So our medical problems really come down to four categories. One is profound neurological problem. Now this usually affects children when they're very young with certain muscular dystrophy, Tay-Sachs, some other congenital heart abnormalities, or you could have cystic fibrosis, some kidney problems that are highly genetic disorders that will affect you later into life. That's a very small minority of patients. You can have things that occurred from the environment, like a car wreck, so you have pins in your ankle or rods in your back, or something from an automobile accident or a gunshot wound. Then you have infections. These are things typically are short-lived in nature. You had pneumonia, sinus infection, things of that sort. But some of cancers, like cervical cancer, head and neck cancer, stomach, liver cancer, these are all driven by viruses, infections. And then so the large bulk of everybody else is driven by inflammation. So this example I gave you where you had some joints that were hurting, you have diabetes, hypertension, and reflux. These are all driven by inflammation. So if you want to try to reverse this trend, you have to reduce inflammation. Your body can recover to a shocking degree, all right? And that's the basis of the whole protocol. It was designed to reduce inflammation to get the autonomic nervous system to recover, but it helps everything else too. Everything else, all right? Like in diabetes, the things you do to reduce your blood sugar will only reduce your blood sugar if they result in a reduction of inflammation. So like everybody's on Ozempic, all right? And as you lose body fat, your inflammation goes down and your blood sugars can greatly improve, all right? Same thing with if you lose weight, you have hypertension, high blood pressure. The blood pressure is only going to get better if the inflammation is reduced with the weight reduction. But you can do other things too, like where's the inflammation coming from to begin with? I've talked about, we've got these inflammatory vegetable oils in the food supply, so the daily olive oil helps protect you from that. You need omega-3s, high doses of this. These are the natural molecules your body uses to reduce inflammation. And then the big source is an imbalance of intestinal bacteria causing what people refer to as leaky gut. In medicine, we call it increased intestinal permeability. This can cause a massive amount of inflammation, all right? And you don't necessarily, most do, but you don't necessarily have to have intestinal issues. And in adults, we use rifaximin. We're starting to use some inulin in adults because of rifaximin supply issues at times, and that seems to help somewhat. And then we use a vagus nerve stimulator. So trying to attack your overall health issues for most people is just inflammation, okay? And if you go at that, like I had a patient yesterday, she stopped her second blood pressure medicine, okay? She was on 2, she's off them all at this point. I had another patient I saw her at the end of last week, hadn't been able to walk her regular walks in the afternoon with her husband for about 2 years because this old fracture in her right ankle after 20 years starts hurting so badly, but so did her back and her left hip. Got her on the protocol, and within about a month and a half, she's starting to walk again. Pain's not gone, but it's so much better. And I think in another 2 months or so, it'll be completely gone. Okay? So you got to attack inflammation if you want to try to turn your health around. That's all for today. Everybody have a great one.